Health Coaching Principles. Welcome to this part of your qualification, which will cover the fundamentals of coaching. The term coaching traditionally involves instruction, with one member of the relationship being the expert and the other being the student. This traditional view of coaching is useful in certain situations, for example, in sports. However, within health and well-being, it can be disempowering and fails to acknowledge the role of the person in supporting their own health and well-being. We use the term coaching in a broader sense to capture the wide array of evidence-based aspects, including communication approaches and psychological strategies that are important to facilitate sustainable health and well-being. This part of your qualification will look specifically at the skills, knowledge, and behaviors that are important to optimize the health and well-being of clients through good coaching practices. Before we can delve into the science of behavior change, personalized care, and other psychological strategies, there is a need to distinguish what health coaching is. This initial session will outline the key concepts and principles of health coaching to provide you with a frame of reference for practice, boundaries of practices, and wider considerations to function optimally as a health coach. This session will cover what health coaching should involve, the role of health coaching within the wider health system, and the characteristics and competencies of good health coaching. Other important aspects of health coaching will be covered in another module, namely aspects of professional practice, including your duty of care, evaluation practice, working within your scope, and dealing with data protection. The previous modules have equipped you to understand the role that lifestyle can have on health, the physiological reasons that explains how this occurs, and also the role that emotional well-being has on physical health. You were introduced to the concept of how mental and physical well-being work through a bi-directional relationship, where they coexist and influence each other. This insight shows the importance of the coaching relationship. The way you act with your client, the practices you put in place, and your demeanor influence directly on their emotional well-being and, subsequently, their long-term physical health. These aspects of practice play a substantially larger part on clients achieving their health and well-being outcomes compared to lifestyle advice. Therefore, as a health coach, you must be competent in understanding what approaches, methods, and mechanisms drive engagement and support human flourishing. The recognition that the interaction with a skilled professional is fundamental for sustained health and well-being has led to a rapid increase in health coach utilizations across various disciplines. Against this backdrop, it is important to be aware of how other organizations and disciplines define a health coach. There are two main distinctions across important organizations. The health coach is fundamentally about building a nurturing and collaborative relationship with a focus on human development. There is agreement that the primary function is to support behavior change and utilize important strategies that facilitate the self-management of health. Moreover, the importance of personalized care and a proficient understanding of building rapport is seen as central to good practice. The role of the health coach then deviates depending on the setting where practice takes place. Our own definition involves the health coach being both proficient in human coaching and behavior change, as well as having an in-depth understanding of exercise for health, emotional well-being, and nutrition. However, some see the health coach primarily about the coaching and personalized care and less about the lifestyle expertise. For example, in England, health coaching has recently been sanctioned as a core part of the NHS. They define health coaching as a partnership to guide and prompt health behavior change and self-management through personalized care. Low patient activation refers to people with a low knowledge, confidence, interest, and engagement with their own health. The NHS acknowledged that a health coach is necessary as a standalone profession, but also as a skill set which other professionals can learn. Within this setting, there are different categories of health coaches: those who target groups of people with specific characteristics, clinical health coaching for those who meet a medical inclusion criterion, and non-clinical health coaching, where there is no special clinical need. As mentioned, the focus here is fundamentally about achieving individual engagement with behavior change and self-management of their health. There is less guidance, scope, and focus on health coaches having the broad skills around lifestyle medicine. Health coaches must also navigate important organizations that they encounter. In England, Local authority clinical commissioning groups have a central role in funding, organizing, and quality assuring local health provisions. There will be central administrative documents and procurement specifications that should be made available to you upon request. This will enable you to see the expectations of practice and the format of the health coaching service. The NHS and Department of Health in England provide central policy priorities, and you should be familiar with them as a health coach. In England, a recent reform means local GPs will be arranged in GP primary care hubs, which aspire to transform care, ease healthcare pressure, and make primary care more attractive. The health coach may be embedded within these spaces. This consolidates care and improves integration with a multidisciplined team and access to specialist advice. In addition, it is important for the health coach to be aware of the local medical infrastructure and have links to resident psychologists, dietitians, pharmacists, and doctors. Furthermore, the current landscape has other key professionals that the health coach needs to be aware of. In particular, the role of care navigators and link workers are important for optimal health coaching practice. Care navigators play a crucial role in helping people get the right support at the right time to meet their needs. In line with the NHS priorities, these professionals provide a holistic and person-centered service that can signpost people to appropriate services. Having established healthcare pathways and trained professionals does not lead to high utilization of services. Link workers provide direction, share decision-making, and increase people's awareness of their health and well-being options. In contrast to the England example above, the corporate and international view of health coaches differs. There is agreement that the health coach is primarily about behavior change and psychological support practiced through personalized care. However, in this setting, health coaches are seen to have an extensive skill set, which encompasses emotional well-being, stress management, exercise physiology, sleep science, and nutrition. This provides an additional reservoir of information and key decision-making that can enhance the person's well-being. A health coach in this setting can not only prepare a client to take the journey to well-being, but provide a roadmap tailored to their individual circumstance, history, and environment. Behavior change science can support someone's commitment to their well-being, but it does not provide the nuanced understanding about how sleep, nutrition, and exercise influence mental and physical health. This qualification adopts this broader definition of a health coach and equips the learner to facilitate change, but also co-design a lifestyle roadmap for optimal well-being. Like any other professional, there is a need for continual professional development. Due to the array of skills in health coaching, it is important for health coaches to know their limits, look for onward referral, but also seek support to develop the various avenues of their practice. The Personalized Care Institute, UK Health Coaches Association, NHS eLearning, and American College of Sports Medicine are useful organizations, which are credible and will provide additional rigor to your practice. The remaining sections of this module will explore the strategies and techniques required to be a health coach. However, over the next few minutes, a summary of the day-to-day practice, mindset, capabilities, and techniques will be given. Remember that health coaching is fundamentally about supporting a person to flourish and optimize their well-being. Once you receive a referral or confirm an initial consultation and check the preliminary data with the client or health provider, you need to consider what health coaching practice will involve. Health coaching will require the practitioner to be aware of psychological barriers that need changing and what can influence people to form new habits. Behavior change science and health psychology provides the frameworks, models, and language to make sense of the barriers and challenges people may be facing. This menu of psychological barriers provides a mental picture of what may be limiting someone's readiness to change or their engagement in their own health. This provides the health coach with priority targets to try and alter using evidence-based strategies. Coaching techniques and models like motivational interviewing provide the tools to uncover these priority areas for an individual. Techniques like open-ended questions, reflective listening, evoking change talk, the elicit provide elicit technique, and scaling questions are all examples of how to uncover levels of motivation and barriers to change and strengthen a client's personal motivation for change. In addition, Specific techniques may be used to address the barriers to change, including behavior change techniques like goal setting, relapse prevention, and habit formation. These and other techniques will be discussed later in this module. Techniques describe the technical application of strategies, but do not describe how you use them. An important aspect of health coaching is the mindset and philosophy of your practice. Collaborative, personalized, and non-judgmental interactions are fundamental to health coaching. The client must feel genuine compassion and empathy when you are working with them. This is done by ensuring their voice is heard, valuing that they are the experts in their own lives, and involving them in their own care. Lastly, although health coaching should be a collaboration, there should be a direction, and it is important to set an agenda and work with people to examine their aspirations for their health and well-being. Health coaches must also be proficient in aspects of professional practice, including GDPR, duty of care, and individual and service evaluation. These aspects are covered in a later module. People adopt specific habits and bear the consequences of their lifestyles due to a complex array of factors. A health coach must not be naive about health and well-being when working with clients. Health and well-being are interwoven with a wider influence on a person's life. Many of the health and well-being issues society faces cluster in specific groups of people. People who struggle with their physical and mental health do not simply lack the willpower to be healthy. A person's social and economic environment, as well as their past experiences, shape their health and well-being. A health coach must not ignore the contextual factors that are important to people. Some aspects might seem on the face of it unrelated to health, but this is far from the truth. Lower education attainment, income, access to green space, and higher levels of crime and vulnerability are all linked to worse health outcomes. For example, life expectancy steadily rises from the northeast down to the southwest of England, demonstrating the influence of the environment on health outcomes. These social drivers of health inequalities increase the chance of poor health but do not dictate it. The role of the health coach is to appreciate these challenges and work with people to best support people in their current circumstances. The following coaching modules will explore the concepts of social determinants of health and health inequalities to provide the health coach with the insight which will allow them to practice in a holistic manner, be authentic, show empathy, and work in a holistic manner. Although flexible, health coaching involves distinct phases. Initially, it is important to make the client feel cared for, valued, and supported. Building rapport and engaging the client is the aim of the introductory section of the consultation. In order to work in a partnership, it is essential that they share their experiences with you and you acknowledge them in directing the next steps. Once you have built rapport and uncovered key information like a person's readiness to change, barriers for change, potential areas for change, and psychological and environmental barriers, you need to focus on the consultation. When working in a collaborative and personalized manner, it can be easy to go around in circles. Focusing practice involves moving the conversation forward and prioritizing aspects of well-being. Next, you need to evoke and strengthen a person's motivation for change while starting to implement a portfolio of techniques that are appropriate based on their barriers. Lastly, agenda setting and goals, if appropriate, can be set. Practice does not always fit into these neat formats, and you may spend one whole session trying to engage a client. Do not rush this process, as it is the essence of health coaching. In summary, this session provided an overview of what a health coach is, the varying definitions that are available alongside how health coaches operate within the English, NHS, and local healthcare systems. A summary of the practices, skills, and mindset was also provided. This session introduces the concepts and principles of health coaching, which will be extended in the following sessions.